In Bellevue, Ohio, Corianne Evans was driving with her 2 young children in the car when she started to overdose. She managed to hit the brakes before she passed out. Fortunately, she was taken to a hospital where doctors revived her before it was too late. She has since stopped taking opioids.
I almost killed my kids. I didn't even have it in park. I could have flipped that car and killed them, or I could have killed other people.
Cody, where do you live?
In Manchester, New Hampshire, firefighters created a program to help addicts after one of the firefighters helped a colleague's brother who was addicted to drugs and on the verge of suicide.
No one agency can do this, no one city can do this. This has got to be an all-out, all-hands-on-deck effort to fix this thing nationwide.
Come on, buddy.
The Centers for Disease Control reports that more than 40,000 people died from opioid overdoses in 2016, a 5-fold increase from 1999. The small town of Hannibal, Missouri, is where Dr. Jennifer Allen practices medicine.
I feel alone in Hannibal. In this area, there's no one else except our clinic for 2 hours.
Hannibal, Manchester, Bellevue. They're like many small towns across the U.S. They don't have resources to fight this epidemic. The University of Missouri School of Medicine uses video conferencing to help doctors in rural areas.
We have therapists, we have pharmacologists, we have primary care doctors and physicians, and really, I'd say as a group, there's a lot of expertise there.
This monitor shows doctors across the state getting training from specialists at the university.
They enter into a learning collaborative where it's friendly, where they can ask their questions, where they can present their patients and come up with a strategy that makes sense, that will really help that patient.
In Missouri, 1 out of every 66 deaths is related to opioid or heroin overdoses.
36-year-old male, not conscious, is breathing, heroin overdose.
Doctors, firefighters, and police in small towns throughout the U.S. understand it will take a team approach to change the trajectory of this epidemic.
It's helping me to understand and say, okay, yes, we're doing things right, or no, here's something we can change or improve on.
Addicts need help without the fear of being stigmatized or arrested. The crisis has become so widespread that the Surgeon General is urging ordinary citizens to carry naloxone, a drug that reverses the effects of a drug overdose and saves lives. Medical experts say ending the crisis will indeed take a team made up of the entire nation. Carol Pearson, VOA News.